Today my patient is about 30 years old. So you can see he's a good donor. If you look at it, he has lost hair. So the way he's lost hair, he's lost the hair from the hairline. This is called the mid-scalp and this is called the crown area. So if you look at it here, look down, the whole area. Now he's lost his hair. So what we're going to do now, let's do this. Let's see the front now. So yes, for the front, doctor has just done the hairline. So this is the hairline. So you can see from the hairline, from the mid-scalp, I'm going to do some dense packing hair and we go a little bit down. This is the mid-scalp area and the crown area. So with a very conservative treatment today, we're going to cover the whole thing. But again, the distribution of the hair is very important. The hair in front here will be dense packing, and then we come to the mid-scalp and we come to the crown area.